Hi everyone, my name is Angela Xiong, and today I would like to discuss the inherent gender biases present in ADHD diagnoses with an emphasis on children and adolescents. So before getting started, I'd like to begin with a short overview of my presentation agenda today, starting with an introduction of myself, followed by my presentation topics, including the background of ADHD in relation to gender, and finally, I will share steps in order to address this prevalent issue. So let's start off with an introduction of myself. Hi everyone, my name is Angela Xiong and I am a rising senior at Mission San Jose High School in Fremont, California. I am very passionate about public health and medicine and I hope to become a pediatric oncologist in the future. I am also passionate about serving underprivileged populations through volunteering at my local food bank and being a leader in my school community's service club. Outside of school, I enjoy conducting research and trying new foods. Okay, so moving on, let's talk about ADHD. What is ADHD and how is it diagnosed? ADHD is one of the most common neurodevelopmental disorders in childhood, and children with ADHD may have trouble paying attention, controlling impulsive behaviors, or being overly active. ADHD is considered as a chronic and debilitating disorder and is known to impact individuals in many aspects of life, including academic and professional, interpersonal, and daily functioning. ADHD can lead to poor self-esteem and social function in children when not appropriately treated. So in addition to age differences in ADHD diagnoses, there are also clear gender differences with respect to the prevalence of ADHD. Males are generally more likely to be diagnosed than females, with a male to female ratio of approximately 4:1. So now I want to dive a little bit deeper into why this this disparity between males and females, specifically in children, exists. So a large part of it has to do with education. ADHD stands for Attention Deficit Hyperactivity Disorder, but oftentimes more emphasis is placed on the hyperactivity component rather than the attention deficit portion of the disorder. The common representation of someone with ADHD is more often than not a hyperactive little boy. But the often neglected reality is that girls and women are affected by ADHD too. But unlike the hyperactive little boy, parents, teachers, and others often overlook ADHD in girls because their symptoms differ from those of boys. ADHD generally presents itself in 3 different types. The first is predominantly in attentive presentation, which is when an individual has a hard time paying attention to details, focusing on tasks, and following instructions, and many girls often present this way. The second is predominantly hyperactive impulsive presentation, which includes fidgeting, talking too much, and being able to stay still for a long period of time. And the third type is a combination of the two. So despite significant revisions in the DSM-3, which is a handbook used by healthcare professionals to diagnose and treat mental disorders, assessment scales and diagnostic criteria have continued to be skewed towards more male-based behavior. And even today, girls with ADHD are often not easily identified because they are typically less disruptive, aggressive, impulsive, and hyperactive than boys with ADHD. In addition, girls' tendencies to mask their difficulties allow them to appear less impaired, but at the cost of being assessed as not needing help. Within a classroom, even despite similar levels of impairments, parents and teachers are more likely to refer disruptive boys for evaluation rather than girls. And girls who do not meet the current DSM-5-TR criteria, which still provides a diagnosis for ADHD that is more oriented towards males rather than females, run the risk of being misdiagnosed with bipolar disorder, depression, anxiety, and/or personality disorders, or not receiving a diagnosis at all. So why is this important? According to researchers, girls with untreated ADHD are at risk for low self-esteem, underachievement, and problems such as depression and anxiety. They're also more likely to get pregnant and start smoking while still in middle or high school. And what's worse is that the girls with untreated ADHD typically carry the problems into adulthood. And once they have children, many of the children have ADHD, and it's only then when the women finally receive a diagnosis. So without acknowledging the various symptoms of ADHD and other neurodiverse mental disorders, females with ADHD will continue to suffer, and the current mental health crisis will persist, and health will continue to deteriorate. So what could you do to prevent and address this prevalent global health issue? First of all, believe it or not, you are already taking a step in the right direction by listening to this presentation. The most important thing you can do is be educated about this issue, acknowledge and understand the disparity present, and share this knowledge with others. ADHD is a multifaceted disorder with so many different presentations. So be an advocate, whether it is for yourself, if you are a woman or girl with ADHD, or if you are someone who wants to help address this issue of gender diagnosis disparity. Advocate and educate others, because understanding the expression of ADHD in females is the first step towards improving detection, assessment, treatment, and ultimately enhancing long-term outcomes for girls and women with ADHD. So that concludes my presentation. Here are my citations. And if you have any questions, please feel free to email me at the email listed on the slide. And I also want to take this time to sincerely thank the Johns Hopkins Global Health Leaders Conference for having me as a student speaker. And it has been such a great experience speaking to you all today. And I wish you all the best. Thank you.